A cough is likely due to asthma if it refuses to go away over days, weeks or months, is worse at night or early in the morning, or if it comes and goes without notice. A cough is even more likely due to asthma if the child also suffers from a chronic rough skin rash called eczema, or if a parent or other close relative has asthma. Kids and adolescents can develop asthma at any age. So, no matter at what age such a cough began, the recognition that the child might have an underlying asthma condition is essential. Sadly, many parents are reluctant to accept a diagnosis of asthma, a dilemma which leads to unnecessary pain and suffering, delay in treatment and even loss of life. For parents who can't come to terms with their child having asthma, I have good news: calling a cough due to asthma quickly gets better with proper medications. Moreover, children can outgrow their asthma. Why people suffer from asthma? People who suffer from asthma have sensitive, hyperresponsive lungs, in the same way that people who suffer from eczema have sensitive skin. A sensitive lung can go into spasm or constriction at any time. Spasm narrows small air channels, limiting airflow within the lungs and suddenly making it difficult for people with asthma to breathe. During such an episode of asthma attack, patients can experience shortness of breath, wheezing, coughing, fast breathing, and chest tightness or discomfort. Wheezing is a high-pitched musical sound taking place in the chest of someone who is experiencing an asthma attack. When loud, people nearby can hear it. But at other times it can only be heard by clinicians who listen to the chest with a stethoscope. Asthma triggers catarrh or runny nose with its concomitant viral infection, cold weather, pets such as cats and dogs, dust, dirt, cockroaches, pollutants, paint fumes, perfumes, mold, grass, pollens and cigarette smoke can trigger already sensitive lungs into an episode of coughing and wheezing. Exercise, as well as emotions, also triggers a cough and shortness of breath in people with sensitive lungs. Cough is a sign of asthma. Cough, a common problem, is one of the many signs of asthma. Parents and caregivers bring children to clinicians when their cough continues for many days and does not resolve with cough syrup. A cough is bothersome to children. It can prevent them from sleeping at night or during the day, can provoke them to vomit, can make them fearful of eating and even cause them to lose weight. When a cough and fever go together in a child, a more sinister illness such as pneumonia comes to mind. Severity of asthma. When evaluating a child with asthma, it is important to assess the severity of the symptoms. Some children have the intermittent form of asthma, while others have the persistent form. People with the irregular form of asthma experience symptoms once in a while. Those who have a persistent form experience degrees of symptoms more often, usually on a weekly basis or a daily basis, and sometimes even several times a day.